back to on-site presentation, I would like to introduce a research about the difference of regional foot loading characteristic in hemiplegic patient after stroke, a preliminary study from Ms. Prangnapas Kongneam.
Good morning, ladies and gentlemen. My name is Prangnapas Kongneam. I am a third-year medical student from Phramongkutklao College University. Today, I would like to present my project in the title of The Difference of Regional Foot Loading Characteristic in Hemiplegic Patients After Stroke, a preliminary study. Stroke is ranked as the leading cause of death worldwide. Like Thailand, the new cases, mortality rate, and disability still increasing every year, as post-stroke patients have extremely high prevalence of walking dysfunction. The most common physical impairment after stroke is hemiplegia, or the weakness on the one side of the body. This picture shows the functional phases of a normal gait cycle that consists of stand phase and swing phase. Gait training is the main focus of rehabilitation programs, so we would focus on the foot loading characteristic as specific regions during gait would provide information about the distribution of foot loss, gait abnormalities, and rehabilitation conditions. So our objective is to investigate the difference of foot loading characteristics in 6 regions between paretic and non-paretic sites in hemiplegic patients. And this is methodology. The data using in this study were collected by the PEDAR system. As shown in the picture, the PEDAR system is an in-shoe dynamic plantar pressure measurement system with 99 insole per 99 sensor per insole. Okay, and this is the methodology. The experiment performed by Sanghan and Hot Sot took place at the Southern Medical Rehabilitation Center of Songkhla Nakarin Hospital. The patients were walked at the comfortable speed along 10-meter walkway for 2 rounds, and then we repeat 3 times. And here is the data analysis. First of all, the data recorded from the PEDAR system were grouped and verified. And then the foot loading parameter during single support of stand phases from 5 consecutive gait cycles were input for regional foot analysis. Then the difference of foot loading parameter between paretic and non-paretic sites were analyzed with PET test using graph path prisms. And here is how we analyzed the regional foot. Foot regions were divided into 6 areas, as shown in the picture, using PEDAR X Expert software. And here's our results. The first table is the demographic data of hemiplegic patients that consists of 60% of male and 40% of female. The average age is about 58.9 years, and we have got 5 left side paretic patients and 5 right paretic patients. This result shows the 2-dimensional and 3-dimensional representation of the average plantar pressure distribution during stand phases. The first figure is represent the left side hemiplegic patients, and you can see that on the left side had the left plantar pressure, especially at the forefoot, in all of the patients. And We also do it again in the right side hemiplegic patients, and you could see that the forefoot and the midfoot of the right side hemiplegic sides had less average plantar pressure than the normal one. And this figure shows the average of center of pressure lines, or we call gate line. You can see that the gate line of the hemiplegic sides had shorter compared with the non-paralytic sides. And we could see that the line was asymmetry between both feet. Then we do some statistical analysis and found that non-paralytic side had greater max plantar pressure than paralytic side in 5 regions. In 2 regions, maximum plantar pressure was significantly higher on paralytic side than non-paralytic sides, especially in the medial midfoot and in the medial forefoot. However, there was one region that are lateral midfoot that the maximum plantar pressure of non-paralytic side was less than the paralytic sides. In conclusion, maximum plantar pressure show imbalanced foot loading in hemiplegic patients that tend to decrease load bearing on the paralytic sides, especially at the forefoot and rear foot. Further study, we will provide more sample size with varied parameters. And this study might be useful for the feedback and monitor device invention, such as smart insole for stroke rehabilitation. We would like to thank all the patients that contribute in our study, and this work is supported by the research funding from Faculty of Medicine, Prangnapas Kongneam University. Thank you for your kind attention.
Now we're in the question and answer session. Do I have any question from the judges, please?
Excuse me. I would like to ask about, do you have any idea about how can you apply the result for practical use?
Okay. First of all, we would like to give a feedback about the gait to the patients, so they will know that whether they get training is improved or not. And in plantar pressure data, we can use like a personal data. We can invent some feedback inventions, such that we put some sensor into the insole and give the patient for get training.
Okay, I see. So you can use it to monitor the clinical progress of the patient?
Yes.
All right, I see. Thank you.
Do I get any more questions? If there is no more question, then we're having a little time for the judges to mark the score.
Okay, thank you.